I'm going to begin by checking your pulses.
Using the pads of your second and third fingers, palpate firmly over the major peripheral arteries. To assess the carotid arteries, place your fingers on the patient's neck, just medial to and below the angle of the jaw. Feel for the bounding wave of blood, which should be easily detected here because the carotids are the closest peripheral arteries to the heart. Remember to palpate only one carotid artery at a time.
Okay.
Simultaneous palpation could cause a slowed pulse, decreased blood pressure, and reduced blood flow to the brain.
Now I'm going to check the pulses in your arms.
All right.
To palpate the brachial pulse, place your fingers just medial to the biceps tendon. As with the other pulses in the arms and legs, palpation of the brachial pulse shows the adequacy of that part of the arterial circulation.
Now I'm going to check the pulses in your wrist.
All right.
Next, palpate the radial pulse, using gentler pressure on the medial and ventral side of the wrist. This is often the best location to assess the heart rate and rhythm, the pulse contour, amplitude, and symmetry, and possible obstructions to blood flow. To determine a healthy patient's heart rate, count the pulsations for 30 seconds and double that. At rest, the rate should be 60 to 90 beats per minute, and the rhythm should be regular. If it's irregular, compare the palpated radial pulse in beats per minute with the auscultated heart rate in beats per minute. Record the difference as the pulse deficit. The contour of the pulse wave should be smooth and rounded or dome-shaped. There should be no cyclic differences from wave to wave. Describe the amplitude of the pulse on a scale of 0 to 4. On this scale, 4 is a bounding pulse, 3 is a full or increased pulse, 2 is the expected amplitude, 1 is a diminished or barely palpable pulse, and 0 is a pulse that's absent or not palpable. On the left and right sides, pulses should be symmetric in contour and amplitude. With the patient supine, palpate the femoral pulses below the inguinal ligament, midway between the symphysis pubis and the anterior superior iliac spine. Ordinarily, the femoral pulse amplitude is as strong as or stronger than the radial pulse amplitude. With the patient prone, assess the popliteal pulse. To do this, flex her knee and press firmly in the popliteal fossa.
I'm going to check the other one now. Now I'm going to check the pulses in your feet.
All right.
To detect the posterior tibial pulse, feel behind and slightly inferior to the medial malleolus. In an older adult, the posterior tibial pulses may be difficult to find. Even in a younger adult, it may not be palpable. If you have trouble finding the pulse, try varying your pressure and feeling carefully in the area. Take a similar approach to the dorsalis pedis pulse. With the patient's foot slightly dorsiflexed, place your fingers on the medial side of the dorsum of the foot. About 40% of the population has only the dorsalis pedis or the posterior tibial artery, so you may find only one pulse or the other in many patients.
I'm going to listen to your blood vessels now.
Okay.
If you suspect an obstruction in a vessel, such as the temporal artery, use the bell of the stethoscope to auscultate it for bruits. These low-pitched swishing sounds should not be heard. Auscultate over other vessels as needed. For carotid artery bruits, listen at the anterior margin of the sternocleidomastoid muscle.
Could you hold your breath, please?
Breath holding prevents respiratory sounds from interfering with auscultation at this site. In a child, a physiologic venous hum may mimic a pathologic bruit. To tell them apart, listen over the carotid artery with the child's head tipped up and away. If the sound is louder in this position, it's a hum. If indicated, auscultate for bruits over the subclavian arteries. Other sites to auscultate for bruits may include the abdominal aorta, renal arteries, iliac arteries, and femoral arteries.
Okay, Mrs. Michaels, I'm going to check your blood pressure now.
Okay.
When was the last time you had your blood
Center
pressure
the
checked?
bladder of the blood
About a
pressure
year ago.
cuff over the patient's brachial artery, 2 to 3 centimeters above the antecubital crease.
We're going to use this blow-up cuff. Would you like to see how it works?
Be sure to use an appropriate sized cuff. On a child, for example, use a pediatric cuff and let her play with it briefly to help facilitate the examination. After securing the cuff snugly, support the patient's arm so that it's slightly flexed. Then check the palpable systolic pressure. To do this, feel the brachial or radial pulse while quickly inflating the cuff 20 to 30 millimeters of mercury above the point at which you no longer feel the pulse. Deflate the cuff slowly until you feel 2 beats of the pulse again. This point is the palpable systolic pressure. Then deflate the cuff completely. After 30 seconds, put the stethoscope's bell over the brachial artery and inflate the cuff 20 to 30 millimeters of mercury above the palpable systolic pressure. Then deflate the cuff slowly and listen for Korotkov sounds. In phase 1, sharp thudding occurs. The first 2 beats mark the systolic pressure. In phase 2, blowing or swishing sounds are heard. In phase 3, crisp thuds grow soft. When they become muffled, that's the first diastolic pressure. In phase 4, softer blowing sounds disappear, indicating the second diastolic pressure. In phase 5, silence occurs. For the systolic pressure, the desirable range is 100 to 130 millimeters of mercury. For the diastolic pressure, it's 60 to 85. The pulse pressure should range from 30 to 40. Repeat the measurement on the opposite arm, pumping the cuff to 30 millimeters of mercury above the expected pressure. Blood pressure measurements may vary by up to 10 millimeters of mercury and tend to be higher in the right arm.
Could you please stand? I'm going to take your
If
blood
you
pressure
suspect
again.
orthostatic hypotension, also take the blood pressure with the patient standing. And if the diastolic pressure in the arms is above 90, also measure the blood pressure in the legs with the patient supine.
Mrs. Michaels, could you turn away from me, please?
Sure.
Thank you.
Next, with the head of the bed at a 45-degree angle, look for jugular vein pulsations between the angle of the jaw and the clavicle. With each pulsation cycle, you should see 3 positive waves if the heart is in a normal sinus rhythm.
Mrs. Michaels, I'm going to check the pressure in your jugular vein.
Okay.
Place a ruler vertically over the heart at the mid-axillary line. Then place another ruler horizontally at the level of the highest pulsations. Where the rulers intersect, read the number on the vertical one. This is the estimated jugular venous pressure, which should be less than 9 centimeters. Next, assess for hepatojugular reflux.
I'm going to press on your abdomen now. Could you turn your head to the side, please?
Yeah, sure.
Thank you. Just breathe normally.
Press one hand firmly over the mid-epigastric region while observing the jugular veins. Watch for the jugular venous pressure to rise as you apply pressure and to fall quickly as you release the pressure.
I'm going to examine your arms and legs for any
Next,
changes in
inspect the
circulation.
arteries and veins for sufficiency. On the arms and legs, observe the skin color and texture, and note any nail changes. There should be no pallor, erythema, or cyanosis, and no thinning of the skin or nails. Also, check the capillary refill time.
Fingernails now.
Press on a nail
Should
bed
hurt.
for several seconds until it blanches. Then release your pressure and time how long it takes for the full color to return. Normally, the nail should regain its color in less than 2 seconds.
I'm going to check your legs now.
All right.
As you examine the arms and legs, look for signs of good circulation, such as the presence of hair and the absence of muscle atrophy, edema, and varicose veins. Next, palpate the extremities for temperature, pulse quality, tenderness along any superficial veins, and pitting edema. The skin should feel evenly warm in all areas, and the pulses should be strong and equal bilaterally. In an older patient, the superficial veins are more likely to appear tortuous and distended. However, there should be no tenderness, redness, or thickening along the veins in any patient. If you detect edema,
You seem to have a little swelling here. I'm going to press on your skin to check it.
check for pitting by pressing a finger or thumb over the tibia or medial malleolus for several seconds. The depression should refill rapidly and resume its original contour. If it doesn't, grade the severity of the pitting. Use a 1+ for a pit of up to 2 millimeters that disappears rapidly. Give a 2+ for a pit of 2 to 4 millimeters that disappears in 10 to 15 seconds. Mark a 3+ for a pit of 4 to 6 millimeters that lasts more than a minute in a swollen-looking extremity. And use a 4+ for a pit of 6 to 8 millimeters that lasts 2 to 5 minutes in a grossly distorted extremity. Finally, inspect for varicosities with the patient standing.
Could you turn around, please?
Be sure to examine the front and back of the legs. As you've just seen, you can discover a great deal about the patient's vascular system through examination of the blood vessels, whether it's done as part of a complete physical or by itself. And your findings, together with the health history and laboratory test results, can form a solid foundation for building the most appropriate care plan for your patient.